9 p.m. Places that get busy with injuries from fireworks are hospital emergency rooms. And joining us now to talk live about that is Kevin Ferrarotti, System Director of Emergency Medical Services with Hartford HealthCare. Kevin, thank you for being with us.
Thank you for having me today, Lisa.
So this is a really important message. What are some of the common types of injuries that you see in ERs over the 4th of July weekend?
Our hospitals and EMS teams are trying their best at injury prevention. However, accidents do occur. So we know whether it be something involving motor vehicles, alcohol-related injuries, swimming or diving injuries, heat exhaustion, your common sun exposure, or more careless types of injuries specific to illegal use of fireworks this time of year.
So have you seen many injuries so far? Here we are Friday going into the holiday weekend.
Yeah, our clinicians and providers have noted an increase in traumatic emergencies over the past few months, partially due to the increase in speeding and careless and distracted driving, which unfortunately now with this weekend ahead, it will be coupled with the increased amount of traffic.
What are some tips to protect yourself from injuries that you can share with us today?
Common sense has to prevail. Making the right choices of driving carefully and safely, monitoring sun and heat exposure. However, firework-related injuries are 100% preventable. These should never be used while you're intoxicated, never around or with children. The illegal fireworks that our law enforcement providers and fire officials are seeing more and more of should and only be used by trained and licensed professionals in a controlled and isolated setting.
So dangerous. And let's talk about people getting together for barbecues this weekend. What is your advice when it comes to COVID-19? Wearing masks, social distancing, those types of things. Tell us about that.
Yeah, the most effective way to prevent exposure to COVID-19 still remains with what the CDC is recommending, which is not only to wear your mask, but to assure that you're maintaining appropriate social distancing, minimizing large groups, using appropriate hygiene prior to eating. Most importantly, stay home and isolate yourself if you have any symptoms related to COVID-19. Obviously, if you do start to experience any signs or symptoms, such as difficulty breathing, chest discomfort, chest tightness, immediately call 911. Our emergency department's and 911 system is ready and more than capable and very safe to use, especially in emergencies such as that.
And real quick, just one last point is you guys have really kept your emergency rooms COVID-free. You kind of separate everything. So people should really know that and seek out help, right?
Our emergency departments are absolutely safe. You should never delay care, especially when it's a time-sensitive incident.
All right, and final tip, we talked about distracted driving. What about distracted parenting? When their kids are in the water, little kids that can't swim, and people are on their devices. Any thoughts on that, how dangerous it can be?
Yeah, absolutely. Your distraction around pools, any type of water areas should be the same tips as you use while you're driving. Your children are the most vulnerable population that you're going to have this time of year, and you want to make sure that you are monitoring them and monitoring the people around them.
All right, Kevin Ferrarotti, thank you very much for sharing these so important safety tips. We appreciate it.
Thank you. All the best for a safe weekend.
And to you, thank you.